And we're live. You know what day it is? It's Wednesday, so it must be Woke Women Wednesday. Senator Diane Wilkerson here with you this morning. I told you I have a special guest. We always, every week, we come to you on Wednesday morning, bringing you information on, I say, all things Black and COVID, which really means all things, because COVID has clearly impacted and entered every single aspect of our lives. But there's all kinds of stuff happening. But I always start, I say thank you to the sisters with the vision who knew over a year ago, just so happened to be in time for COVID. The planning was already at work, but they created a medium for us to give you information on a timely fashion that you could use every day. And you're going to hear that today on this last Wednesday. Nope, next to the last Wednesday, right? Of of the year. We're in December, folks, and a lot of us, I don't know if you think about it, but God, get on your knees and thank God that we're here.
Mm-hmm.
Think that, because there's almost 900,000 Americans that are not. And so it's just not a joke. It's a blessing. It's not about lucky. It's about being blessed, that God has given us the right to see another day. But thank you to the Sisters with the Vision for bringing us WWOCradio.com Facebook Live. So today, as we are just days away from Christmas, the first official of the end of the year holidays, and then within a week we'll be at New Year's, and obviously on Sunday we start Kwanzaa, and I know what that means, and you all know what that means. So I don't preachy. I'm not going to tell you, oh, don't gather. You shouldn't, because I know y'all gonna do it anyway, right? And so what we want to do always is just to give you some information on how to do it safe. We call it healthy for the holidays. And there are things that you can do. There are things that you must do when you are entertaining. You have your parent. My mother is 86 and she's going to be at my house. And so I have it all planned. I got test kits at my front door. So anybody who, my two sons and my grands, they're going to have to take a test and sit in their car for 15 minutes. And I'm saying, come back to me. I'll see it. And that's just the way it's going to be, because I can't have them near my mom and expose her, because she's, like I said, she's in her 80s. But our guest today, Dr. Catherine Hall, if you all don't know, you better know. You should know, because there's a whole, like, I call this is like the dream team that has been created right in Boston City Hall. You saw our new since September, executive director of the Boston Public Health Commission last month, I think earlier, October, November. Dr. Basola Ojikutu was with us. And here's the deputy. The deputy, I saw her, I had a chance to watch her in action on Saturday at the Melnia Cast, when Boston Public Health Commission, the city of Boston, allowed the Black Boston COVID-19 Coalition to partner with them. We had a Vax clinic. Why? Because people are rushing. People know, like they say, our folks don't pay attention. I know they do, because I see them standing in lines all over this community trying to get tested and getting vaccinated and getting boosted. And so it's because of the work of people like Dr. Catherine Hall, who is the deputy executive director of the Boston Public Health Commission. And I invited Dr. Hall to be with us this morning, because I thought, 72 hours literally before Christmas, right? Isn't that weird? Like, that's just wild, right? But people have questions like, what can we do? What should we do to be safe? So first, I just want to introduce you to Dr. Catherine Hall so she could tell you a little bit about herself, and then we're going to get to the information. So Dr. Catherine Hall, MD, that's right. The sister with the letters and the degrees and the knowledge. Welcome this morning. It's so good to have you. Welcome.
Thank you, Senator Wilkerson. I just want to clarify, I'm a PhD,
Okay.
not an MD.
Good.
Yeah.
The knowledge part is
the knowledge. Yeah. It's such a pleasure to be here this morning. And we are doing all we can to get the message out about how to keep our residents in Boston safe all the time, but in particular right now during the holiday season. And also during this, what looks like to be, unfortunately, another surge in the COVID pandemic. At the Boston Public Health Commission, I'm really honored to work alongside, as you said, Dr. Basola Ojikutu, who is a international expert in infectious diseases, and also, our fearless leader who is really, I think, leading the charge, along with Mayor Wu, to keep us safe, to protect, to promote, and preserve the public health of all residents in Boston. So what are we doing? You had asked me that earlier, and I want to say that we have, 4 key points, 4 key strategies that we're working on. The first one is to get people vaccinated. And I want to talk a little bit about vaccination before I give you the why get back, let's talk about why get vaccinated. Okay. So firstly, vaccination is the most powerful tool we have to fight this pandemic. Okay. Why is that? Because, we have designed a vaccine that is specific to fighting and, basically stopping COVID, and the virus that causes COVID in its tracks. Of course, the vaccine doesn't work if we don't take the vaccine, right? And the thing is that the vaccine doesn't work if it's been too long since we've taken the vaccine. So literally 6 months after you've taken both doses of Moderna or Pfizer, the effect of the vaccine starts to wane. It starts to wane. And so by 6 months, you need a booster. And they have shown that the immunity that the booster allows you really brings you back to the level that you were when you first got the vaccine, right? So I want to say that the tests show that if you only get 1 shot of the vaccine, with this new variant, you only have 20% protection. If it's been 6 months after you've had your 2 shots, you're only getting 20% protection. If you get your booster and you've had your primary series, your 2 shots, you're back to 70%, which, let me tell you, Omicron is a tough cookie. And that's the thing that we don't realize. We think that we're in our homes, we're doing our things, we're trying to get back to the supermarket, trying to get back to friends and family, trying to get back to, going to the gym, and just living our lives. But the virus, its mission is to survive. The virus's mission is to figure out how to spread itself to as many people as it can so it can replicate and spread itself. We're in the middle of a video game.
Right.
We're in a video game, and it's like we've gone to level 2. And the virus is not stopping. So the virus is very tricky. It's trying to figure out, how can I get into these people, into their cells.
Latch onto somebody, right?
Yeah, latch onto somebody. And so what's it going to do? You've all seen the pictures of the virus, right? With those spikes sticking up. Those proteins are called spike proteins. And they literally lock into a receptor that's naturally present on cells in the human body. Our vaccine blocks that ability to bind, right? So if you don't have the vaccine to stop that link, in comes COVID, in comes a virus, it locks into your lung cells, gets into your lungs, and then it's just starting to divide. Then you can't breathe. Then you're getting fatigued. Then you're getting sicker and you're going to the hospital. And what happens when you go to the hospital? Everybody's going to start going to the hospital. They're not going to have the beds.
That's right. We're close. And it's something, the first time around, and I think it has a lot to do with the media, right? Because they showed us every day. Remember, we had that ticker. They would show the number of bodies. Well, the ticker's gone. They would show the emergency rooms every day. It's not happening. And so people think, they don't understand that we're in the same situation, except this time we have some armor, we have some ammunition, and it's called the the vaccine. And if you don't take it, but Doc, one of the things that I would like you to talk about, because we had a testing clinic yesterday, and one of the things that we had to constantly say to people: put the mask over your nose.
Oh Lord!
Put the mask over your nose.
Yeah.
For some reason, people think if it's here, right? No, it's got to, like, let me just say, the mask got to be here.
Yeah. To
Here
get your,
don't
yeah.
count.
No,
This don't
no,
count. This
no.
doesn't count.
This is basically saying like opening the door
Come
to
on
COVID and
in.
say, come on in. This is the front door to your lungs,
Yes.
right? COVID's going right in. It's getting into your lungs, and now you can't breathe. Now
Through
you
your
not
nose, people.
through your
Through your
nose,
nose.
through your nose. It's crazy. I don't like to wear a mask, but I
Me
tell
either.
you, you do something long enough, you start to get used to it.
Yeah.
And now I feel like, oh my God, why am I out here? Like, where's my mask? And I
If you
go home
open
and
your
I get my
front
mask
door,
on.
right? You open your
Yeah,
front door. This is for me. Open my front door, and I feel wind on my mouth, and I'm like, oh, it's like your keys, right? If
right,
the wind
exactly.
touches my face,
Yeah,
my mouth, I know something's wrong, and
yeah,
that's how I remember it. Like, oh my God, I don't have the mask because
yeah.
yeah, it's gonna be routine. It's gonna be routine for a while, but if
Has
that's
to
what I
be.
have to do,
Has to be. Has to be. And like put them in your car, put them in your bag, put them in your back pocket, put in, it's winter time, stuff your coat pockets, just have a few. I put things in my socks, like not into the sock, but at the side of the sock.
I hear you.
Like whatever you need to do, put them in your bra, like, like
Yes.
get your mask with you, you
Yeah,
know.
yeah. Talk about Omicron a little bit. What's
Oh
that?
Lord, Omicron. Omicron is like level, it's kind of like I said, it's like the video game. Like you beat back that level and now you gone to the next level and this thing coming at you is new. Omicron has figured out how to mutate itself so that piece that's binding can bind more effectively, right? And so it is highly transmissible.
So when you say mutate, you multiply. That's it.
No, 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 no. Let me explain to you. The virus is basically a piece of what looks like RNA. It's kind of DNA, but it's the kind of related to DNA. It's RNA, right? So it's a ball of protein with a piece of genetic information inside, right? The genetic information, when it gets into your body, is read by your body, and it tells your body to make more virus.
Adjust to. Okay, gotcha.
Right?
Gotcha.
Now Omicron is very smart. Well, SARS-CoV-2 is a virus that causes COVID-19. That virus is trying to survive, right? So we were like, okay, we're going to stop you in your tracks. We made a vaccine, and it said, oh, you made a vaccine? Did you make a vaccine to this? And so it changed the
Yeah.
cap. It changed the spike protein, right? And luckily for us, the vaccine is still working. But COVID is smart, and now COVID can get around to more people more quickly. It is significantly more transmissible. And so we're going to see the cases doubling and tripling. What's happening in Europe is shocking because they're ahead of the curve. That Omicron was first found in South Africa, and it seems to have gone to Europe first and then come here, and it's moving across our country very quickly. Soon it's going to be the dominant strain. Remember we had Delta? It's going to be Omicron. I think right now about 70% of cases are Omicron.
Right. So
And yeah.
last night I reported 47 of the 50 states now have Omicron virus,
Yeah, yeah,
presence in the state.
yeah.
So talk about who's impacted and the degree to which that impact and why.
Well, like I said, what Omicron's done is it's figured out a way to get to the door to your cells very efficiently, and the vaccine does is it blocks the door so they can't get in. But here's the thing: you block the door with your mask, you block the door with the vaccine. But if you don't get boosted, you don't have the blockage that you need.
That's right.
So most of the people, a majority, and we really need to hear this, a majority of the people going to the hospital right now are unvaccinated. What does that tell us? The vaccine protects you,
Yeah.
right? And the vaccine protects you. You might still get a little sniffle. You might still get infected by COVID, but it's not going to take you out like it's been taking people out.
So I just want to amplify what Dr. Hall just said. Those of you just joining, Dr. Catherine Hall, the Deputy Executive Director of the Boston Public Health Commission. The vaccine doesn't stop you from getting COVID. Just like a flu vaccine doesn't necessarily stop you from getting the flu, it stops the flu from killing you. It stops the COVID from killing you, right? So 99%, this is again, I have to read update every day, CDC, FDA, CDC, 99% of the people who survived or hospitalized had been vaccinated, who survived COVID had been vaccinated. Because it's that armor. Like I said, it doesn't stop you from getting COVID. It stops COVID from getting you. Period.
Wow, I love it. Yeah,
Right?
yeah,
Right?
yeah.
And so we have to say that because people will say that like that's some kind of proof as to why they shouldn't take it. Well, I know people got vaccinated, got COVID. Yeah, they lived. That's the
They live.
point.
That's why you know them, right?
That's why you don't know
Yeah,
them.
right.
Right?
And the thing about it is, it's not just, like you may not go to the hospital when you get COVID, but there's this whole syndrome called long COVID where you get over it, but you're still tired. You get over it, you're still fatigued. You get over it, you're still achy. You get over it, and you're still depressed.
Yeah.
Long COVID is no joke. You don't
Well,
want
I know
you.
I know people who are suffering from it now, and
Oh,
one of the things that that you said that I just want you to talk a little bit more about, because 2 weeks ago was the first time I read about waning immunity and what that means. It don't
mhm,
last forever, folks. We go get
mhm.
another flu shot. We go
Yeah,
get another flu shot, right?
yeah,
And so talk a little bit about that, because again, when people say, "Oh no, now I got to get a booster,"
yeah. The way the vaccine works, right? Let's talk about that. The vaccine is a little, just enough of something similar to just a little piece of the virus. Actually, it's a piece of the spike protein that tells the body, make something that can block that. Your body makes them. They're called antibodies, right? And your body naturally, and we're doing that all day long, right? When we like get a cut and we get a little bacteria, the body breaks down that bacteria and makes antibodies to it. So next time it sees it, it can shut it down.
right?
That's your natural. We're using your natural reaction of making antibodies, but your body is very smart. If you stay all day long making the same antibody over and over again, then your body doesn't have the reserves to make antibodies for all the things that you're experiencing and getting exposed to. So the body has a system. The body says, "Oh, we haven't seen this in a long time, so we don't need to make this antibody all the time." What the booster does is the booster says, "Hey, make some more of those antibodies." It's that simple,
Got you.
right? So when you get the booster, so you get the vaccines, you start to make the antibodies, you have protection. But your body's saying, "Look, we're not seeing any virus, so why are we making this antibody? Let's just kind of stop making the antibodies,"
Right.
right? And then you get the booster, and the body says, "Oh, you want me to make more of that antibody?" And boom, you make the antibody
That's a
again,
wonderful description and explanation
right?
for the people get, because yeah,
Yeah.
yeah, like
And you
anything
know what?
else.
Until COVID is not with us, we're going to have to get boosted again. We got to fight this thing.
So here's the other thing that I wanted to share with you, because I know that this is on the minds of so many people, because those of us who, and I'm not by any means, I'm not a social media techie, like I know basics, right? But what I have been reading all the last 2 3 weeks is the announcements, and then the shock at the number of younger Black men dying of COVID, in the
Mm.
40s and the 30s, and everybody that is listening, in this area will know when I talk about Allah, who owned the
Mhm.
barbershop in
Mhm.
in Dudley, not because he was a barber, but because he was an activist, because he spoke so much of his time and energy on young people, teaching them, manners, and using the whole
Mm.
culture, respect. He did a huge cookout for the kids in the community every year, back to school activity. Opened up his place.
Mm.
Was really
Mm.
one of the. See, I know him because in the last year and a half, he's been one of the lead advocates for the barbershops and the beauty salons that were suffering because of the lack
Mm.
of revenue during COVID. So that's the advocate that I know. and people are posting like I went to last Saturday. I went over there to get a haircut. It was closed, and I was surprised because he died in his sleep over the weekend of COVID. 48 years old.
Mm.
He was not vaccinated, from what I understand. And the reality is that it has caused a lot of conversation amongst other Black men, and
Mm.
which I think is a good thing. I think it's a great thing. But
Mm.
folks, this ain't about this. They talk about like gout. This is not an old people virus
Mm-mm.
anymore.
Mm-mm.
They were
Mm-mm.
the worst, the most vulnerable, and we started because we weren't prepared for it. And they were the least prepared because they different, the comorbidities they had. But
Mm-hmm.
as we have settled into this, as we say in
Mm-hmm.
the last year and a half, children,
Mm-hmm. Yeah, no,
teenagers,
it's so sad.
so brothers, we had testing. We did testing yesterday at Roxbury Multi Service Center.
Oh, uh-huh.
And well, first thing that was alarming is in the first 30 minutes, 3 people tested positive. Yeah. And but more so, there were two. We did testing. We weren't doing vaccine. And
Mm-hmm.
so two young Black, when I say young, I mean under 40, came in and
Mm-hmm.
said, I need the vaccine. I said, oh, you want a booster? He said, no, this is my first one. I'm ready. And we
Yeah,
actually were
yeah,
able to send them right across the street. The building right across the street, the Muse, BMC was there doing
yeah,
vaccine.
yeah,
We were doing testing.
yeah.
They were doing vaccine.
Oh,
He said, no, this is my first one. He said, I'm ready. I can't deal
mm-hmm.
with this anymore.
No.
They're paying attention. And we may not like, we might be saying finally, no, I'm not. I'm saying thank the Lord that they
Mm-hmm.
got that message, because
Mm-hmm.
there's so much that people, so much I said the social media can be a wonderful tool, and it can be a major nuisance because you can get a lot of information, but also means in that a lot of misinformation
Yeah,
and
yeah.
disinformation. And so I was just so pleased to hear him say that. I kind of gave him, we did the knuckle fist pump, because I ain't hugging. Nobody. I ain't hugging. I'm not hugging.
Oh, Lord.
But
Oh.
this, and I had two of young men in their 40s inbox me yesterday and said, where can I get a vaccine today?
Mm-hmm.
Where can I get
Mm-hmm.
boosters? So I've been
Mm-hmm.
giving them, because here's what I also see. I want you to talk about Saturday, because it's like the reality and the myth. The myth, oh, Black people are not paying attention. Black people don't care. Black people this, and Black people don't want. And then you see Saturday, right?
Mm-hmm.
So I would
Yeah,
love for you to
yeah.
talk about what the BPHC's clinic on Saturday, this past Saturday, at the Mount Near Cass Rec facility on Martin Luther King Boulevard.
Yeah. And so we had Boston Public Health Commission working very closely with community partners like the Black Boston COVID Coalition. Senator Wilkerson, thank you so much for getting the word out. I can't tell you how many people I talked to in that line who told me that they heard about it on Facebook, through you. So we are so grateful to the work that you do to kind of connect the message to people and help them connect them to the service that we can provide. We held the clinic at the Melnia Cass Recreation Center in the heart of, Roxbury, a community that has high COVID rates of not just cases, but deaths and low vaccine rates. And the message was, come out, you don't have to bring anything. You don't need an appointment. You don't have to pay. We're going to be giving out Target gift cards and, some food and snacks and so on. Just come and get your vaccine. Just come and protect yourself, protect your family
That's
and your
right.
loved ones. And Dr. Ojikutu and Mayor Wu had put out the call to people to come and get vaccinated. And the people of Boston heard it, listened, found out where they could go through community partners like yours, and they came. And they came in the hundreds. We had 649 people. And I have to say the wait wasn't that long because we're very efficient.
People were commenting as they left about how efficient and seamless the process was. So I want
Yeah,
to thank you all, because what happens is they go tell their friends and family.
yeah, yeah, yeah. And let's get the word out. And that's one. So, like I said, we have four strategies, right? One is to have more testing. One is to have more clinics. One is to get the word out, and one is to really kind of double down on policies to get us to mask, policies to get us vaccinated. Policies to get us really following the precautions that have been shown. The evidence shows that masking, that vaccinations, that social distancing protect us. Why are we not protecting ourselves? And you know what? I want to say this to the people who are not vaccinated yet. I understand. And there's no, this is not about blame.
Right.
Okay? This is about now's the time. Now's the time.
And you know what? I told you the 30 minutes goes so quickly. We're wrapping, but the last thing I want you to talk about, though, is that
Yeah.
piece where you say now's the time. Talk about what's going to happen in January and why. When you say, when Dr. Hall says this is now's the time, really, folks, you don't want our entire life has been so kind of constricted. There are so many things that we used to do that we can't do anymore, and that if you don't get yourself prepared for the next set of restrictions and requirements in January, your world is going to shrink even more, because there'll be some things you cannot do.
Again, and let's go back to the barbershop and beauty salon analogy, right? Or experience. People were able to get back to the barber salons, right, and the beauty shops, because back earlier in the year we took the precautions that we took. Remember back when we had the last surge, we didn't have the vaccine, and people were so happy when we got the vaccine and things started to win and get under control. But the problem was not everybody has access to the vaccine. And in poor countries, let me tell you something. There are countries in this world where people don't even have the option. They don't have anywhere to go and get the vaccine. And so if they get infected with COVID, they get very sick. And when you get very sick, you know what the virus is doing? The virus is like,
Right.
let me multiply and let me spread. And you know what? While I'm at it, let me figure out how to make let me put on my best Sunday dress so I can get into your church.
That's right.
All right? That's what the virus is doing. The virus is not sitting around, being the same virus every day. The virus is figuring out how it can get in the front door, changing its hat, changing its dress, changing its what is going to get it past the bouncer at the door. And so Omicron has done this. But you know what? If we don't deal with Omicron by getting vaccinated, there's a whole Greek alphabet after O. Don't
And then
let
when
us
they
get to
finish that
Zeta.
Z, they start all over again.
I know.
Just like
Oh, Lord of
hurricanes and
mercy.
tornadoes, right?
Yeah.
Yeah. So the holidays, folks. You'll see the crawl at the bottom. It says it's time to rethink the holidays. We want you to be healthy for the holidays. There's some things you can do, like continue washing your hands constantly. If you haven't abandoned it, continue the physical distancing. I got to say physical distancing instead of social distancing. Wearing the mask. First, though, on the list, get vaccinated. This week, you can get vaccinated. In our community, you can go Prince Hall today and Grove Hall, 10 a.m. to 3. They are doing vaccinations. Russell Auditorium on Talbot Avenue, Carver Lodge, they're doing testing. Tomorrow afternoon in Mattapan Square will be from 3 to 7. We'll be doing testing kits available for you to have over the holidays. We'll have them at 1626 Blue Hill Avenue. And those are just ours, the ones that Bromley Heath has been there every single day. Everybody knows the Mildred Haley Apartments, the Bromley Heath, Bromley Hall, right there on Heath Street. You can see it from Tremont Street every single day, right? You can so take advantage of them. Put your family in a position where they're going to be safe. Because like I said, I ain't gonna tell you all don't gather, because I know y'all gonna do it anyway, right? We do. We know you're gonna do it anyway. We get it. We can say you shouldn't, just not more than 10. But the bottom line is that there are definitely things. Doc, you want to add anything that people can do to
Yeah.
keep safer?
If you feel sick, stay home.
Stay home.
It's not worth it because you want to have next Christmas and the next Christmas. But if if you take the chance, you think, oh, maybe I just have a cold. You might just have a cold, but you might not. So get tested if you can. Find the local testing place. Senator Wilkerson just named a lot of places where you can go. You can go to boston.gov and get more information
That's
about
right.
where you can get vaccinated, where you can get tested. It is available. You can do it. You can contact us at 311, the mayor's health line, and get more information. Do what you can to stay safe. It's so important for the long view, for all our family and friends, and for the residents of Boston.
That's right. Let's stay safe, everyone. And with that, I'm going to thank Dr. Hall again. Dr. Hall, you have to come back. As
I
long as
would
we have
love to,
COVID, we're
always.
going to need you
A
all to do,
pleasure.
we're going to need you all to constantly just providing updated and accurate information. That's what the WWOC airspace is all about. Thank you again to all of you who are with us. I can tell you what happens is that our viewers, this is for folks who are not watching right now. We share this today, and I tell folks, get your pajamas on. Friday night, your cup of tea, your hot chocolate, a glass of wine, and just listen. It's going to be the most important and information-packed 30 minutes you'll spend. Dr. Hall, thank you so much. Have the happiest,
Thank
safest
you.
holiday. Thank you for
You
all
too.
that you do. WWOC will be back to you one more time in 2021. I'll see you next Wednesday, the 29th of December. Thank you.
Bye.
Thank you. Thank you. Stay
You're
safe.
welcome.
Wear your mask, folks. Get vaccinated. Get boosted. Bye-bye.
Bye.